I'm going to suggest, Amish, that you have been a critic of the Chinese policy on the pandemic. How does that nation dovetail its stated policy with people, thousands, descending upon Beijing?
They can't. It's a contradiction. It's inevitable that they're going to get COVID cases, especially with the Omicron variant, its ability to evade immunity, and some questions about the efficacy of the Chinese vaccines. All of that is going to cause a perfect storm for their COVID-0 policy. It's going to be shown overtly to be untenable. And unless they kind of resort to the authoritarian measures that they have throughout this pandemic, it's going to be something that the world is going to see, and their population is going to see, that this was not a sustainable approach to a virus that was always destined to become endemic.
If you advised Olympic authorities and, quite frankly, NBC, with billions involved in broadcasting, all the other broadcasters worldwide, what would be your advice to Olympic management, Olympic staff?
My advice would be to expect that you're going to get cases, to use the tools we have, rapid tests, making sure people are vaccinated, having antivirals on hand, and then also to push back on Chinese policies that kind of are premised around this idea of COVID-0, and to really at all points not accept any kind of authoritarian measures that may be put into place in that setting. I would really be vociferous about it, because I think that they need to understand that this isn't the way that you handle an endemic respiratory virus, especially in 2022 with all of these tools. And
Dr. Adalja, let's move to the other side of the extreme. South Africa came out and actually removed self-isolation for those with asymptomatic cases of COVID. Do you think that that's appropriate, taking a step to that place?
Eventually, we're going to manage COVID-19 much like other respiratory infections, where we sort of have the honor system and we tell people isolate when your symptoms abate. And I do think we're heading that way towards COVID-19. And that would be probably one of the things that happens when we start managing this like other seasonal respiratory viruses. I think it's hard to completely do that because we still in the United States have too many high-risk people that are unvaccinated. So we still want people to make sure they're not contagious. And this is where I think if someone's asymptomatic and their rapid test has become negative earlier than those 5 days that the CDC recommends, you can think about, I think, right-sizing people's isolation periods. I think we need a little bit more science and data on this, but eventually I do think that people are going to be able to go about COVID-19 the way they do with other respiratory viruses. And if they're sick, they stay home. If they're not, they don't. And we'll use masks strategically in that situation as well.
It does seem, however, Dr. Adalja, that there are some lingering effects of COVID that are different than what we've seen in other types of common colds. How does the healthcare system deal with this? And is this going to be a significant strain that perhaps is being underplayed?
We first have to understand a lot more about these lingering effects, because everything is sort of getting grouped into that category. And I think we need a lot more science to actually understand what is true and related to COVID-19, what isn't, and then we can try and understand why this happens. But what we're seeing is healthcare systems are trying to meet this demand. They're setting up long-haul COVID clinics. They're setting up trial registries to try and understand and study these individuals and see how their symptoms change over time, what may help them, what doesn't help them. All of that's going to be part of the post-pandemic phase, is dealing with whatever proportion of people are left with long COVID. But one thing is certain, is if you're vaccinated, you're much less likely to get long COVID. So this is something that came from the first wave of infection before vaccines and now is happening because people are not vaccinated.